Okay, namaste all. So, in the series of the diseases, the next disease which we are going to study is Rudrog. Okay, so let us see what exactly is Rudrog. You know this word Rud, right? We have studied Rudbasti. So now you know what Rud means. Rud means heart. So Rog is disease. So disease related to the heart or heart disease is Rudrog. So let us see what is mentioned in the classical textbooks. The disease in which there is vikruti of the physical and physiological functions of the Hruday or heart is called as Rudrog. Let us see again the disease in which there is vikruti of physical and physiological functions. So there can be vikruti, abnormality in the structure of the heart or the functions of the heart. So physical abnormality or physical changes in the heart will certainly affect the physiological functions. Of course, having said that, when there is physiological abnormality, it does not essentially mean that there would be any physical damage to the heart. Okay, so the disease in which there is vikruti of physical and or physiological functions of Hruday or heart is called as Rudro. So any disease, any abnormality related to the heart, physical or physiological functioning of the heart will be termed as Rudro. So Rud is heart and Rog is disease. Hruday is a Sadhyo Pranahar Marma. We know, we have come across this word marma or vital point even in the past while studying diseases or even while studying the practicals. We came across this word marma, vital point. So marmas have been mentioned. So sadhyo pranahar marma is one type of marma. Sadhyo means immediate and pranahar means takes away life or causing death. So it causes immediate death. So trauma or damage to this particular vital point or marma can lead to immediate death. So that type of vital points on the body are called as Sadhyo Pranahar Marmas. So there are various Sadhyo Pranahar Marmas which are mentioned on the which are mentioned in the textbooks present on the body. Out of that, Hruday is one of the Sadhyo Pranahar Marma. So any physical damage or trauma to the heart, we know this during accidents or say a bullet piercing the heart, the patient will die immediately. Or an arrow or any pointed object which pierces the chest and enters the heart can lead to immediate death. Also, a Mula Sthana of Rasavaha and Pranavaha Srotas. We know the Srotas, the channels, have Mula Sthanas. Okay, their origins. So, Hruday is Mula Sthana for Rasavaha Srotas and Pranavaha Srotas. Okay, so when there is vitiation or Rasavaha and Pranavaha Srotas are affected, the functioning of heart is uh, is disturbed, and vice versa. When there is abnormality in the heart, we can see the effect of that on the Pranavaha and Rasavaha Srotas. Rudrog is a disease of Madhyama Marga. We have seen this in brief in between as well, that there are various roots of the diseases. Rudrog is in the Madhyama Marga. So Hridrog is a disease of the Madhyama Marga. Hriday is a sthan of Pranavayu, Vyanavayu, Sadhaka Pitta, Avalambaka Kapha, mind, and Ojas. Nice revision for you all. So Hriday is a location. What all is located at the Hriday? Pranavayu, Vyanavayu, Sadhaka Pitta, Avalambaka Kapha, mind and ojas. So pranavayu, because origin of one of the sthanas of pranavaha srotas, hence pranavayu is considered to be present at Hriday or near Hriday, and pranavayu will nourish the Hriday. Okay, so that is how pranavayu is considered located at the Hriday or the Ura region. Vyanavayu, we know it uh, takes care of functioning of the heart. Sadhaka Pitta is located at in the heart region. Avalambaka Kapha is also uh, located at the uh, heart. So we see three dosha, presence of all the three doshas in the heart region. Vyanavayu, Sadhaka Pitta, and Avalambaka Kapha. They have their own functions of functioning, own functions of uh, they have their own functions in the heart region. Mind is so heart is also said to be the location of mind. However, mind, according to Ayurveda, is Sarva Sharira Vyapi. Sarva Sharira Vyapi means it encompasses the entire body. However, it is the gati, the speed of mind is so fast that one moment it will be at the toe nail, and the next second it will be near the ear, the next second it will be at the the little finger, and the next it can be at the hair root as well. So the speed of the mind is very fast, hence it is called as sarva sharira vyapi, but the location of it, uh, or the headquarters of mind, is considered to be the heart. And ojas, the location of ojas is hriday. So when there is abnormality or rudrog, you will see abnormality in functioning of pranavayu, vyanavayu, sadhaka pitta, ulambaka kapha. The mind is disturbed, and ojas also gets disturbed. Hence, we did discuss this during Rudbasti also, that if patients have disturbed uh, mental state, if they are holding their negative emotions uh, for a long time or very frequently, then Rudbasti will certainly help in these kind of patients. And we see this for sure as a result of Rudbasti, that patients feel lighter, they feel more relaxed, they tend to throw out their negative emotion. So most of them would cry and uh, release the negative emotion. So that is Rudbasti. So you can connect the dots and understand that Hriday is the location of mind, and Rudbasti helps in releasing the negative emotions stored in the Hriday. So types of Hriday Rog: Vataja type, Pittaja type, Kaphaja, Sannipataja. So dosha type 4, and Krumija. Now, where else did we see Krumija type of disease? In which disease did we see Krumija as? No, it's okay. Homework for you. Rudrog. So the hetus: consumption of atiruksha, ushna, guru, kashaya, tikta ahara. Okay, so all these are various dosha aggravating food items. So atiruksha will be vata, ushna will be pitta, guru will be kapha, kashaya, tiktahara, again vata aggravating food items. Excessive physical activity. Excess of physical activity. We have seen that anything which requires more strain on the muscles is ultimately going to strain two organs. Which two organs?
Heart and
Which
lungs.
two? Heart and
Lungs. Lungs.
lungs. Very, very good. So, excessive physical activity is going to strain the heart activity. Trauma to the chest can cause Rudra. I just talked about it, that any trauma to the chest and the functioning of the heart can get disturbed, and if the heart is not able to bear the pressure, the trauma, and the impact of the trauma, then it can suddenly stop working as well. Okay, so uh, we see a lot of videos nowadays. We hear about it that there was trauma to the chest, and because of that, the patient died on the spot because of cardiac arrest or cardiac failure. So trauma to the chest, adhyashana. Okay, having food over food, so consuming food after the meal is adhyashana. Excessive thinking, worrying, related to the mind. Excessive thinking and worrying. And also excessive thinking and worrying will affect which dhatu?
Rasa Dhatu.
Very good. So rasa dhatu, and it will also vitiate the rasavah srotas. Okay, so excessive thinking and worrying is related to the mind, and mind is located at in the heart region. Holding of natural urges. Contra effect of vamana virechana basti. So what is contra effect? Mithya yoga, that is called in Sanskrit, mithya yoga, of the karmas, the cleansing processes of vamana, virechana, and basti. So um, whatever ill effects of or the opposite effects of vamana, virechana, basti, it can lead to rudroga. Holding the natural urge of chardi, vomit. So holding the natural urge of vomit. We've seen this in the past. Holding natural urge of vomit. What can it lead to? Which disease? Hika. Sorry, Shita Pitta. So holding of natural urge of chardi will put strain on to the heart. Highly intellectual people. So we see that the occurrence of Rudroga or heart disease is quite common in uh, people who are more thinking process is more, or usage of intellect is more in their profession. Uh, Again, the stress levels are higher, so in them also the heart uh, disease, occurrence of heart disease or Hridrog is found more, right? Not all highly intellectual people will have heart disease, but based on the occurrence which is seen, you can always relate that highly intellectual people can have high amount of stress and can cause heart disease. So Samprapti. Hetu 7, so you can see two pathways. Due to in Hetu 7, excessive worrying, thinking will lead to Vaigunya in heart. Disturbance in physiological functions of the heart will happen, and sthana samshraya of the aggravated doshas will happen in the heart region, can cause Hridrog. So excessive worrying, thinking regularly, intensely will uh, will create Vaigunya in the heart, and the aggravated doshas will go and take sthana samshraya, ashray at the heart region, and can cause abnormality in the functioning of the heart, which will lead to Hridroga. In the other pathway, Hetu 7 will lead to Dosha Prakopa. Rasadhatu vitiation will happen. The Dosha Prakopa will cause vitiation of Rasadhatu, and vitiation of Rasadhatu, the vitiated Rasadhatu will enter into heart, the heart region, and will cause the heart disease. We know that Rasadhatu, Rasa Vikshepana is the function of the heart, and when there is vitiated Rasadhatu which enters the heart, it will uh, take ashray of heart, and it will stay there. It will create Rudro. Okay, so there will be Sthana Samshraya, the Vaigunya will be at the heart region where the doshas will come, and the aggravated doshas will come and stay and will create Rudra. Aggravated doshas will vitiate Rasadhatu. It will enter into the heart as a physiology. Rasadhatu, after it is formed, physiologically enters into the heart, and because there is Sthana Samshraya of doshas there, it will create uh, the abnormality in the functions, and it will cause Rud Rog, disease of the heart. So what do we see in Purva Rupa, premonitory signs and symptoms? Chest pain, breathlessness on exertion. Okay, so chest pain will be uh, not too frequent. So there is a chance of the patient missing it out. He or she may, the patient may relate it to indigestion, lack of sleep, or some muscle pain. Okay, and will miss it many a times. But if the patient is quite aware about the health status, and does not neglect chest pain, and comes to you or reaches a medical facility, there is a chance of finding some structural functional change in the majorly the functional change in the heart. So nowadays you do ECG, and in the ECG or 2D echo, you see abnormality in the functioning. Okay, so chest pain usually should not be neglected or overlooked. Breathlessness on exertion. So on exertion, because the heart has to pump more blood when exertion or physical activity, muscle activity is happening. So that time the heart has to function more with more strength, and because there is abnormality in the heart, and the functioning may not happen properly. So Lack of blood supply, lack of oxygen will be the resultant, and breathlessness can be seen on exertion. So that breathlessness will settle after the patient rests. So the patient may not relate it to a heart disease. The patient may relate it to lack of exercise, or sudden activity, or a reduced stamina. That okay, I have reduced stamina because I'm not exercising regularly, or uh, I did this suddenly, hence I'm feeling breathless. I do not, my stamina is reduced, etc. So they may not relate that breathlessness to abnormality in the heart. They may relate it to something else. Okay, because that breathlessness will subside on resting. Shotha over the feet and face. Okay, so uh, Shotha will be seen because of the strength of the heart is reduced. So in that functional abnormality, the venous backflow which comes, that comes with less pressure, because the pumping is with less strength. Hence, the blood which flows back is reduced. Hence, you see, Shotha in is one of the uh, symptoms, signs which is seen, and it can be. So when you see Shotha, two things which you should think is, one is the heart, second is the kidney abnormality in functioning. So in heart, majorly patients with heart problems, they will see Shotha in the feet, especially the face also, in the extremities can be seen Shotha. Difficulty in deep breathing. Okay, difficulty in deep breathing may be one of the Purva Rupa which may be seen. So difficulty in deep breathing, how can you relate to pranavaha, srotas or pranavayu? Yeah, abnormality in the functioning of pranavayu. We know pranavayu, it will help in inhalation, and udanavayu will help in exhalation. So deep breathing will be disturbed or hampered because there is abnormality in functioning of the pranavayu. So this will not happen to the fullest of extents. Hence, uh, the patient will experience difficulty in deep breathing. Rupa stage. So, abnormality in functioning of pranavayu. What are the signs and symptoms which are seen? Kasa, hikka, shwasa. We know all these have similarity in origin, similarity in pathogenesis, and are related to pranavayu. So kasa, hikka, shwasa can be seen due to abnormality in the pranavayu, impaired perception of sensory organs. So one of the important functions of pranavayu is perception of the sensory organs. So the functioning of the sensory organs will be hampered because of the abnormality in pranavayu. Because of abnormality in Vyanavayu, tachycardia, Shotha. So tachycardia is the uh, the heartbeats is faster. Okay, so fast heartbeats or number of heartbeats per minute are more. That is called as tachycardia. The opposite is bradycardia, reduced number of heartbeats per minute. That is called as bradycardia, and this is tachycardia. So and Shotha, because of strength of the pumping of the heart is reduced. Hence, uh, Shotha can be seen. So that is abnormality of Vyanavayu. Abnormality in Sadhaka Pitta, palpitation, fear, panic will be seen. Okay, palpitation uh, is strong heartbeat. Okay, strong heartbeat means the patient will feel the the heart is beating uh, with intense pressure. Okay, so that will be palpitation and feeling of uh, fear and panic will be there. Avalambaka kapha, cardiomegaly. So avalambaka kapha will hold the muscles of the heart together compact, will give it the strength, avalambaka kapha. And when there is abnormality of avalambaka kapha, there will be laxity in the muscles. Strength of the muscles will reduce. Those will become uh, weak, and then the size of the heart will automatically increase. That is called as cardiomegaly. Size of the heart increases. That is called as cardiomegaly, and that increase is due to the laxity or weakness in the muscles of the heart. Okay, so that is uh, the function of the avalambaka kapha to hold it together. Now that is abnormal or that is vitiated. Hence, there is increase in size of the heart. So increase in size of the heart does not mean that it will take more blood and it will pump out more blood. The increase in size is due to the weakness in the muscles. So you can imagine that even if the muscle, the blood coming inside is normal, the pumping force is less. Hence, uh, uh, increase in size does not mean that the efficiency of the heart will increase. Okay. Ojasa, because of abnormality in ojas, change in complexion, lusterless, dull, pale, or dark looking skin. So, skin complexion will change in Rudrog when there is vitiation of Ojasa. So, complexion is the resultant of good or healthy Ojas in the body. So, the luster, um, uh, there would be dullness, um, the skin may become pale or it may become dark. So that will be abnormality of ojas, and murcha, unconsciousness, can be seen due to ojas. Mind or manas. Manas is the Sanskrit term for mind. Manah or manah, manas is the same, which means mind. So because of disturbance in at the psychological or mental level, fear, disinterest, or low on energy is seen in Rudro. Okay, so disinterest or low on energy because of lack of morale is seen in Rudro. Impaired taste in the mouth, Trushna, Chardi, chest pain, these are other signs and symptoms which are seen. Trushna, Chardi, chest pain, impaired taste in the mouth. So specific signs and symptoms in Vataja type of Rudro. So some causative factors are also mentioned here: grief, fasting, excessive exercise, rukshahara, alpahara, shita ahara. So shita, sparsha and guna, both. Touch, cold food and cold potency food, both. So excess of grief, excess of fasting, excessive exercise, consumption of excess of rukshahar, less ahar. The hunger is more, but the patient eats less. Okay, so that can lead to Vataja Rudrok, and excess of Shita Ahar or cold food, cold potency or cold to touch food can lead to Vataja Rudrok. So what are the signs and symptoms which are seen? Pain in the chest region. Pain, of course, we know that because it is Vata, pain is typically present more, or the intensity of pain is more. So there are types of pains which are present in the chest or which the patient can experience: throttling pain, throbbing pain, pricking type of pain, cutting type of pain, pounding type of pain. So the patient will explain this to you while the patient tells about the pain, that I have pricking pain. I feel that something is poking me from inside, or like needle is pricking, or I'm feeling as if something is cutting me. So the feeling of cutting by knife will be that type of pain will be experienced. Pounding type of pain, as if something is constantly pounding on the heart or in the heart region. So that type of pain is explained. So if you ask the patient properly, and if the patient uh, can explain it properly, they will tell you uh, this very particularly, that the pain is this type. And also you should make it a point, whenever the patient tells you about pain, you should ask, what how do you feel, how is the pain, what is the type of pain. So if you are aware of, is it pricking pain, is it cutting pain, is it pounding pain, is it burning pain, so that type of questions, leading questions, if you ask, the patient may think, try to recall and explain. But few patients are very particular and they will tell you, okay, this is this type of pain. Okay, so Vataja type of Rudrok, pain in chest can be throttling type, throbbing type, pricking type, cutting type, pounding type. Feeling of emptiness in the heart. Okay, Rud Shunyata. Shunyata is the Sanskrit word, emptiness in the heart. So emptiness in the heart is a feeling of low morale. Okay, the patient is feeling uh, low on energy, or demoralized completely. So that is feeling of emptiness in the heart. Feeling of grief, fear, sadness for no reason. Okay, so external factors may not be present for these emotions, grief or fear or sadness, but internally, because of the disturbance in the functioning of the heart, the patient is experiencing grief or fear or sadness without any known reason outside. Okay, so the patient will tell you this. If you ask, okay, I'm feeling um, I feel scared or I'm feeling sad, then you may ask, okay, any particular reason for that? No, I'm just feeling like that. There's no reason. So that is feeling of these negative emotions for no reason is indicative of Rudrok. So if you do Rud Basti in this case, it will certainly help. It will certainly help the patient. Difficulty in breathing, palpitation, irregular heartbeats, murmur sounds in the heart. So these are the abnormalities which will be seen: irregular heartbeats because of vata. So the heartbeat beating will not be a rhythmic. Arrhythmic heartbeats will be there. Murmur sounds in the heart. So because of the arrhythmic or irregular heartbeats, the murmur sound will be heard. So that will be heard on auscultation uh, with uh, with the stethoscope. Okay, Rupa of Pittaja Rudrog. In in the hetus, ushna, amla, lavana, kshara, katu ahara, you know the meaning of these words. Ajirna bhojane means having food when the previous food is not digested, so that is ajirna bhojane. Alcoholic drinks, consuming more alcoholic drinks, so which are again ushna, tikshna, amla rasatmak, and vidahi. So alcoholic drinks which will aggravate pitta. Anger aggravates pitta. Exposure to hot sun or even heat, for that matter, it will aggravate pitta dosha, and it can cause rudroga. So what are the signs and symptoms which are seen? Bitter taste in the mouth, chardi with ambla or tikta taste, trushna, excessive sweating, jwara, ruddaha. Ruddaha means burning sensation or feeling of burning sensation in the heart region. Okay, so patient, this is quite typical in Rudrog, which patient uh, can tell you that there is burning sensation in the chest region. Now, few patients may consider that burning sensation because of acidity as well, so you have to ask them the location, because heartburn uh, is one typical symptom which is seen in hyperacidity. So these two things should be, the patient should be able to uh, tell you and distinguish between, and you should be able to ask them specifically related to, ask questions related to hyperacidity and food and other lifestyle things which can cause heartburn. So they will be able to, you would be able to judge properly if it is related to hyperacidity or it is the burning sensation in the heart region. Okay. Murcha, suffocation. So murcha is unconsciousness and suffocation. You know what is suffocation. So that feeling will be there in Pittaja type of Rudroga. So bitter taste in mouth, Chardi, Amla and Tikta. So Amla Rasa is due to Samapitta and Tikta Rasa is due to uh, Pitta. So natural taste of Pitta is Tikta, and when it is Amla Rasatmak, it is, there is Samata in that. Okay, so line of treatment for Amla Rasa Chardi and Tikta Rasa Chardi is different. We saw that in Chardi as well as Amla. In Kafaja type of Rudroga, what are the uh, signs and symptoms which are seen? Kafaja Ahara Vihara is, we know what is Kafaja Ahara Vihara, Guru, Snigdha, Madhura, excess quantity of food, Ati Ahar. So it can cause aggravation of Kapha dosha, cold potency food. It can cause aggravation of Kapha dosha. So what are the signs and symptoms which are seen? Heaviness in the body. Heaviness, obviously, because of armor as well. Heaviness in the chest region. So heaviness basically is a typical sign, a symptom of aggravated kapha dosha. So heaviness in the body, heaviness in the chest, stiffness in the chest, stiff feeling of stiffness, like uh, things are locked or things are packed. So that feeling will be there in kaphaja type of rudra, as if things have slowed down. The activity has slowed down. That is the feeling. Kasa, drowsiness. So drowsiness is again due to aggravated kapha doshas. Feeling of sleepiness. Drowsiness is feeling of sleepiness. And so you have to, patient can also tell you, I feel tired, I feel sleepy. So uh, what is the major symptom? Is it feeling of tiredness or is it feeling of sleepy? So leading questions, when the patient tells you and if you feel that okay, the patient is telling something different than what usually it should be, then you can start asking leading questions. So low on energy, tiredness, feeling of sleepiness, drowsiness. So what is the presenting symptom? So getting in order to get proper information, if you ask leading questions, then the patient will start explaining their feelings. Excessive salivation. Taste, one more thing, sorry. If you ask specific questions to the patient will understand that you are not going to listen to anything which is not related or which is irrelevant or which is of less significance. So if you ask leading questions, then you expect a precise answer. Correct? So the patient also will start giving you precise information rather than just absurd talking. They will give you specific things. Of course, as a practitioner, you have to be a very good counselor. You have to listen to what the patient is saying. However, because you have to treat the patient, you're just not listening to them. You have to understand, absorb, interpret, and then decide the line of treatment. Hence, you need specific informations. So, in order to have clarity in your mind, you have to ask leading questions, and then the patient will start giving you precise answers. Okay. Apart from, once you have got the precise answer, then you can let the patient talk so that the patient will feel relieved after talking to you or after sharing. Okay, so counseling is a important part of in the treatment itself, because just 2 3 days back we had gathered for a conference or a seminar where we were discussing about certain diseases, and one thing which I realized, because it was a mix of the doctors, there were Western doctors, there were other pathy doctors as well. I realized that the amount of time which we give as Ayurveda practitioners to the patients in order to understand their concerns is far, far, far more than what the other pathy doctors do. So here we hold a upper hand because we have various things to ask the patient, various things to discuss with the patient, which indirectly makes the patient talk, which indirectly makes the patient feel relieved and makes the patient feel special, because the other doctors give very less, or in fact 5 minutes to 7 minutes is what they will give to the patient. They will just see the reports, ask a question, or just listen to something, and they will keep writing their prescription. And once it is done, okay, take these medicines, see me after 3 months. That's it. That is it. And when we do consultations, we have so many things to ask, so much to discuss, so many suggestions to give, and then finally we talk about medicines or we just write medicines. So, when we are holding an upper hand, let us take full advantage and do the best what we can do to the patient and to the society. So, excessive salivation, tastelessness, or sweet taste, feeling of sweet taste in the mouth, tastelessness can be seen, salivation, excessive salivation. I use the word praseka for that. Okay, praseka is the Sanskrit term used for excess salivation. So Preseka also happens uh, before the Chardi Vega. Chardi Vega. So that is after nausea, Preseka will happen. So Rullas, Preseka, Chardi. That is how the stages are. So excess of salivation is one of the uh, symptoms which the patient will tell in Kafoja type of Rudra. Sannipataj Rudra. Here the mix of signs and symptoms of all the three doshas are seen. Apart from that, change in complexion, Shwasa, Rutshula. Rutshula means pain in the chest region, Jwara, fever, Shotha, edema, murmur sounds. So the sound of due to a rhythmic movement of the heart or a rhythmic heartbeats. The murmur sounds will be heard on auscultation with the stethoscope, and those will also reflect in the ECG and the 2D echo of the patient. Okay, drowsiness is seen, murcha is seen in Sannipata Rudrok. So here, what we understand as practitioners is it is not single type of or single dosha vitiated uh, Rudrog or single dosha dominant Rudrog. It is more of a Sannipata Rudrog, and we have to treat according to the signs and symptoms which the patient shows. All right, that is Sannipata Rudrog. Krumija Rudrog. Now here it is a bit different than what the modern science uh, would explain. This is different. So how does the Hetu Seven happen? Excessive consumption of sesame seeds or sesame food items. So sesame preparations basically. Sesame oil or sesame pinya kavino, the paste of sesame seeds and sesame seeds also itself. Then milk, consumption of milk, jaggery. So these may be consumed together or even separately. So when they are consumed in excess, they will lead to a formation of cyst in the heart. Okay, a small cyst will be formed in the heart. Formation of kleda will happen in the cyst. Growth of krumi will happen in the cyst. So due to presence of kleda, uh, growth of krumi will happen. Krumi is worms, right? Small worms. Those are, see, when we say krumi, according to Ayurveda, the krumis are varied types. So if you read krumi, you will find various details about the types of krumis, and the krumis which are there in the Rudrog mentioned, they are sukshma. Sukshma means very tiny and small, which cannot be seen with naked eyes. So those type of krumis will form in the cyst, and biting pain, pricking pain will be experienced by the patient. Biting type of pain, something is biting inside. So those krumi, uh, the worms will eat the muscles or the part of the muscle of the heart. So biting type of pain, pricking type of pain will be experienced. So pricking type of pain will be experienced in other type of Rudrog as well. But biting type of pain, if the patient is able to explain you properly, then you can relate it to Krumija Rudrog. Nausea, salivation, shwasa, under eye, dark under eyes, anasarca. Anasarca is swelling, generalized swelling on the body. Anasarca. So biting type of pain is quite typical to Krumija type of Rudrog. The occurrence of Krumija type of Rudrog is comparatively a bit less. But if the patient says that I have biting type of pain, if the patient is able to experience and explain you properly, then you can relate it to Krumija Rudrog, and you can ask the patient questions about consumption of sesame milk, jaggery, or abhishandi ahar together. So that is the hetu and the pathogenesis and the signs and symptoms together of Cromesia type of Rudro.
One question.
Mm-hmm.
Yep. So is jaggery and milk, are they incompatible?
Jaggery and milk, yes.
Yes. Yes. Okay.
Yes.
Okay.
Yeah.
Yep.
Milk is Shitavirya, jaggery is Ushnavirya.
Okay.
Okay.
Yep.
So prognosis in Rudrog, newly developed Rudrog can be treated with difficulty with long-term treatment. Okay, so it is not that it is easily treatable. It will be treated. It can be treated with medicines, but it will be difficult to treat, and it may take a bit longer to treat. But newly developed ones can easily be identified, and the treatment, medicine-wise treatment, you can uh, start the treatment or do the treatment, treat Rudro. Chronic and with complications are asadhya with medicines. Of course, as I have said this multiple times, sadhya, asadhyata. Now, because the science has developed so much, asadhya vyadhis, diseases which are not treatable with only medicines, can move to the next level or can be treated with other modalities of surgery, etc. Also. What are the complications in Rudrog? Brahma, dizziness, klama, feeling tired or exhausted with any exertion, without any exertion, feeling of weakness in the heart. Okay, so klama is quite typical word used in especially the heart diseases one, and severe depletion of rasadhatu. Okay, so feeling tired or exhausted without any exertion. So in sitting position also, or without any major work also, the patient will start feeling or will feel tired. Feeling of weakness in the heart, this is typical to the heart disease. Okay, so klama is a generic terminology also, but klama in Rudro, the feeling of weakness in heart is experienced by the patient. Body ache, dhatu kshaya will be the complications. In Krumija Rudrog, excessive salivation, pratishay, headache, chardi, shotha will be the complications. So, chikitsa of Rudrog. Sattva Vajay Chikitsa. Sattva Vajay Chikitsa, have you heard of Sattva Vajay Chikitsa before? Anybody from the students? Have you heard of Sattva Vajay Chikitsa before? No? Say yes or no. If you say no, I explain. If you say yes, I'll ask questions.
No.
Sorry? No.
No.
Okay. So you want me to explain it? Okay. So Sattva Vajay Chikitsa basically is reassurance treatment. So when there is involvement of mind in the disease formation or in the signs and symptoms, if you see that psychological disturbance is there, reassurance to the patient is important. Now this is more important when it is a serious type of illness related to heart, related to brain, related to um, cancers, various cancers, or even Rajekshma. So where the intensity of the signs and symptoms is there, the severity of the disease, the patient may not know on paper that okay, this I have uh, uh, got a disease which is, or I'm suffering from a disease which is very severe or very serious, but they will gauge it from the signs and symptoms which they are going through. Okay, so in that, Sattva Vajay Chikitsa becomes quite important because medicines, even the chemist can give. Correct? Medicines, even the chemist can give. You have a prescription, the medicine will be given by the chemist. But reassurance is something which you should give as a counselor. A reassurance to the patient. Okay, you may deep within know that, okay, this is very difficult to treat, or this may not be treatable at all. But giving assurance to the patient, it is not false commitment. You are just saying everything will be all right. Touching the hand of the patient, touching the forehead of the patient, keeping hand on the shoulder, on the back, will will give them reassurance. See, willpower is beyond everything. I'm sure you must have seen a lot of examples that willpower goes beyond everything, any medicine, any surgery. It is the willpower which will make the patient stronger and stronger. So there have been instances where the doctors have said, okay, we are done from our end. You can take the patient home, let them live whatever life they have left, and they can uh, peacefully die in your house or in presence of your family members. And those patients have come out of serious illnesses just on their willpower. So Sattva Vajay Chikitsa is nothing but you are doing a treatment to their mind without using any medicine. So that is giving reassurance, assurance to the patient. And this will help more when uh, the mind is involved, and when the patient has realized that he or she is suffering from a serious illness. Okay, Sattva Vajay Chikitsa, keeping the patient away from all manasik hetus, telling the patient, or more importantly, the relatives of the patient, the family members, that keep the patient away from fear, from grief, from anger, from greed, worries. Now, fear will be within the patient, greed will be within the patient, anger will be within the patient. So that can be taken care by Sattva Vijay Chikitsa or reassurance. But uh, anything which comes from outside, agantuja, from outside, uh, the family members will help in that, or they will play a major important role. If the environment in the family or in the house is soothing, the patient will heal faster. Okay, so the heart needs something which is soothing, which is pleasing. Okay, a mere sight of few things, the heart will feel, or your mind will feel relaxed, will feel fresh, will feel pleasant. So those pleasing things have to be around the patient in order to help the patient come out of that problem faster. Patients who have experienced heart attacks before, I'm sure you must have heard this, that the doctors tell, do not tell them anything which is uh, or a bad news to them suddenly. Do not tell them anything negative suddenly. It has to be told to them slowly, and in a take time, and then prepare their mind to bear that um, impact of the issue or of the concern. The sudden death is there, and of a close family member, and this patient who has recently had a heart disease, or is suffering from a heart disease, if suddenly knows about it, then those emotions may suddenly disturb the functioning of the heart, and it can cause death of that patient also. So keeping pleasing environment around will help the patient recover faster, uh, who is suffering from the heart disease. So Sattva Chikitsa. Ahara should be beneficial uh, for the heart. So Hitakara Ahar for the heart, nourishing to the ojas, that kind of food should be given to the patient. So um, Madhura Rasa, Amla Rasa. Amla Rasa is considered Rudya. Rudya, which means nourishes the heart. Okay, Amla Rasa is considered Rudya. So that those type of food items, easy to digest food items, milk, ghee, they are nourishing and pleasing to the heart, soothing to the heart, not pleasing, soothing to the heart. So those type of food items should be given. Gold, silver, so suvarna, raupya, mauktika, pearl bhasma. These bhasmas will help in giving strength to the heart muscles. Uh, and Arjuna. Arjun is one herb. Terminalia arjuna is the scientific name, a botanical name for this particular plant, and it is considered to be the best herb for any type of heart disease. So Arjuna has good properties which will give strength to the heart muscles. Okay, and it is Rudya medicine. So when we have patient with heart disease or patient who are in the recovery stage of a heart problem, we do give Arjuna Kshirapak, Arjuna Arishta, Arjuna Churna um, to the patients. So they it helps in giving strength, overall strength to the heart muscles. So when there is cardiomegaly or laxity of or weakness in muscles, that time Arjuna will help tremendously. So Arjuna Kshirapak. So milk which is medicated with Arjuna will help in the, cardiomegaly better than anything else. So typical or specific chikitsa for Vataja type of Rudrog, Snehana, Swedana, Vamana. Now Vamana is Mrudu. In fact, to explain this, contraindications in Vamana, Virechana, in fact, most of the Panchakarma, Rudrog is contraindication. Rudrog is considered as contraindication to do any type of Panchakarma. But in this case, Vamana is mentioned in the classical textbook. So it tends to confuse us as students that should we do Vamana in this case, or in Vamana case we should not exclude Rudro. However, contraindications to Panchakarma Rudrog still stays valid. We as students have to understand that when it is contraindication, sometimes it may not be absolute contraindication. If there is utklesh of doshas, the aggravation of doshas is to an extent where it should be removed out, then we can administer mrudu or mild version of that particular karma, any shodhana karma. So in this case, mrudu vamana. Now vamana actually gives uh, creates a lot of pressure on the heart because it is emesis. So the patient has to take efforts to uh, vomit out. However, such medicines can be used which can create less pressure, and the doshas can come out with ease. So, a skilled practitioner, experienced practitioner should use Vamana only in milder form, and when he or she has learned how to use it uh, with efficiency in Rudroga. Okay, so Snehana Svedana, Vamana if and the doshas are aggravated to that level. Abraka Bhasma, Dashamula Kwatha Arishta. So Abrak Bhasma is good for the respiratory system, I said, and also it gives strength to the pranava srotas and as well as the muscles of the heart. Okay, Abraka Bhasma. Dashamula Kwatha, Dashamula Arishta. Dashamula, decoction of Dashamula or Arishta of the fermented version of Dashamula can be used to pacify Vata dosha. Arjuna Arishta, I already spoke about Arjun. Brihatwal Chintamani, Lakshmi Vilas Ras. These are preparations which have gold bhasma in that. Even the other mineral metal bhasmas are also there, which are good to give strength to the heart and improves the functioning of the heart. So you will find various. So what I have done is I have included those preparations which are very typical and peculiar in treating a particular type of disease. So, so that you are aware that this can be used in the treatment. However, all may not be available in your case. So, I have also tried to choose things which are available uh, in terms of medicine or in terms of herbs in your place. So, you may not be able to use Bruhatva Chintamani because it is not available, but the other things which are available there, like Dashamula Kwatha or Arjuna Rishta, also may can be available there. So those can be used. But Bruhatva Chintamani, Lakshmi Vilasras, you should know, at least as students, that okay, this is an important medicine in treating Rudra. Shunthi, people in Shunthi is ginger, so ginger powder basically. Pipali, long pepper, celery seeds. Hingu is asafoetida. Marich is pepper, cumin seeds with lemon juice. So these herbs, these spices will help in settling down or pacifying Vata dosha with lemon juice. I said uh, just few minutes back that Amla Rasa is considered or is said to be Rudya, which nourishes the heart. Okay, it is good for the heart diseases. So Anupana, lemon juice or anything which is Amla Rasa can be used as Anupana, which will carry or carrier. Anupana is carrier, which will carry the medicine to the heart. Amla Rasa has affinity towards the heart. Pittaja Rudroga.
Go for it.
Hello? Why
Hmm.
we don't have any root basti proposal for the Vatajan?
Why?
Root basti, it's not included in the chikitsa.
In the treatment. Yeah, you can do Ruth Basti. See, even if it is not mentioned here, it is whatever lists or whatever things are mentioned here are reference points. With your experience, with your knowledge, and whatever we learn, you can keep on adding. If you have any difficulties, you can ask me during the lecture. So it is a good point about Ruth Basti. So Ruth Basti with oil, uh, Bala oil, Chandan Bala Lakshadi oil can certainly help in Vataja type of Rudroga. Okay.
You as well suggest Shirodhara to pacify a bit the mind and nourish?
Shirodhara in Rudroga,
Yeah.
Rudbasti will help better.
So no Shiro.
Shirodhara may not help to that extent.
Okay.
When you have Rudbasti available as an option, very few people will use Shirodhara.
Okay.
Why do you want to use Shirodhara when you have Rudbasti? Okay, so in Rudroga especially. But if you have, say, a skin disease, which has disturbance, mental disturbance, and has caused skin disease, then Shirodhara and Rudbasti both will work better. Okay.
Yeah. Thank you.
In Pittaja type of Rudroga, Lepa, Shita potency herbs, sandalwood, camphor, yashti madhu. So this Lepa can be applied in the heart region. Shita herbs, sandalwood, camphor, yashti madhu. Mrudu virechana should be given, even virechana should be given mrudu, mild. So what can be used? Raisins, black raisins. We have spoken about this. Aragvad is a herb. So the pulp of Aragvad uh, legume can be used for mrudu virechana. Amalaki can be used. Suvarna Sut Shekhar is one preparation which has gold bhasma. Sut Shekhar we know. So this is Suvarna Sut Shekhar which contains gold bhasma. Is good. Suvarna Sut Shekhar is good overall for pacifying Pitta dosha. So Suvarna Sut Shekhar can be used in this case as well. Praval bhasma, the coral bhasma is good. Pearl bhasma, Mauktika bhasma. Kharjuradi mantha, I think we have spoken about Kharjuradi mantha before. So what it is, Kharjuradi mantha? It is dates, grapes, raisins, pomegranate, tamarind, amalaki. So take these, soak them for 3 to 4 hours, or you can soak it overnight. Then mash and crush them properly. You can maybe grind and blend it as well, and that can be given to the patient for this is as a recipe also. This is good for uh, a rehydration wherever you see dehydration, weakness, uh, that time you can give the patient Kharjuradi mantha. So these things soak in water, and you can grind them next day and filter it and give it to the patient to drink. Excellent rehydration uh, will happen through this. So uh, you must have heard of ORS, oral rehydration solutions. So it acts similar to that. Nothing else needs to be added to this. No salt, no sugar, no jaggery, etc. Okay. Sweet fruit juices. So fruit juices of sweet taste and madhura rasa and madhura vipaka can be given to the patient. So they will pacify vata and also will be good for good as rudya to the patient, to the heart. Kafaja Rudroga, Ruksha Svedana, Vamana. So, because it is Kafaja type of Rudroga, Snehana is contraindicated, should not be done. Even Svedana, which is done, is Ruksha. And Ruksha Svedana is mild Svedana. So, we know Ruksha Svedana we did with Potali. So, that can be done. Ruksha Svedana, in fact, if you have to do full body Svedana, then sauna can also be prescribed. But for a very minimum time, the patient starts sweating, and immediately you can ask the patient to come out. Don't wait for 7, 10, 20 minutes, etc. A Vamana should be administered in Kafaja type of Rudro. Again, Mrudu Vamana in controlled conditions. Controlled conditions means you should be ready prepared for any kind of complication if it happens. Langhana with Lagu Ahara. So here, Langana fasting initially without food and then with Lagu Ahara should be done. Hemagarbha is a gold preparation, gold bhasma preparation, which can be given in Kapaja type of Rudro. Karaskarvati is one preparation which is very good in Kapaja type of Rudro. Arjunarishta, again, it is Arishta. So, Arjunarishta in Vataja and Kapaja will settle down the dosha properly. In Pittaja type of Rudrok, you can give Arjuna Kshirapak, medicated milk medicated with Arjuna Churna, Arjuna powder can be administered in Pittaja type of Rudro. Arishta has self-generated alcohol, so that can aggravate Pitta at times. So in that case, you can give Arjuna Kshirapak in Pittaja type. In Sannipataja type of Chikitsa, Rudro, the Chikitsa should be Langhana, Lagu Ahara, next treatment as per dosha symptoms. So first is Langhana, then Lagu Ahara, and whatever treatment is to be done should be done as per the symptoms according to the doshas. In Krumija type of Rudro, Mrudu Virechan, to give Anuloma Gati to Vata, Virechan should be given. And Langhana, Pachana, Krumi Mudgarasa. So Krumi Mudgarasa is specifically to kill the Krumi in the heart region, which have developed. And so Krumi Mudgarasa basically is good for any vermicidal action which you expect in the patient. So in other diseases also, if you feel that there is presence of Krumi, then Krumi Mudgarasa, Krumi Kuthara Rasa can be given. Hemagarbha Rasa, gold preparation should be given. So gold preparations basically are very good for nourishing the heart. Hence, gold preparations, you will see gold preparations in all the treatment related to heart. Okay, so it will rejuvenate the heart muscles. It will give strength to the heart muscles. Suvarna Bhasma. Hemagarbha Rasa is a gold preparation. Lakshmi Vilas Rasa also is a gold silver Bhasma preparation, which should be given in Krumija type of Rudroga. Pathya, complete rest, liquid diet, so which is easy to digest. Lagu Ahar, again easy to digest. One more thing in Rudrog is we have to make sure that the patient doesn't have constipation. Okay, Malavashtamba doesn't have Malavashtamba. So in order to make sure that the patient does not have Malavashtamba, either Anuvasan Basti or Matra Basti can be given, enema, or you can ask the patient to consume milk and ghee, say a cup of milk and one teaspoon of ghee in that warm. You can ask the patient to drink at bedtime. So bedtime means 30 minutes before the bedtime. You can ask the patient so that it will give uh, softness to the stool if in case the patient is having constipation. Because if the patient is constipated and has to strain more while passing the stool, it will create immense pressure on the heart. Okay, because the abdomen will uh, uh, create the pressure. The pressure will come on the diaphragm and it will then stimulate the heart as well. Okay, so that can cause damage to the heart. Hence, we have to make sure. So, if you have seen other patients who get treated with Western medicine, they give stool softener medicines, or they give enema as well, warm water enema, or soap water enema to the patient, so that the stool is passed without any strain. So, Lagu Ahara, rice or semolina kheer. Okay, so kheer, what is, how do we explain kheer, Sonia? It is
It's
a
like a
preparation made
pudding.
with milk,
It's like a
pudding,
rice pudding. Yeah.
rice pudding, but liquid form,
Yeah,
more
liquid.
liquidy, more liquidy.
Right.
Yeah, so that is, so rice is cooked or semolina is cooked in milk, and that is given. So milk will become nourishment to the heart, and it, because it is consumed warm, it will also give anulomagati to vata. Grapes are good for the heart disease. Pomegranate, lemon juice, old rice, moong dal, meat soup of desert animals is easy to digest. So soup of that meat, bitter gourd is good for uh, as pathya. Apathya will be guru, vidahi, oily or deep fried food items, astringent foods uh, can become apathya. Astringent food items, basically, why they will become apathya is because if they are consumed, of course, in heavy quantities only, then it has a tendency to absorb the liquids. Correct? It has a tendency to absorb liquids or fluid part, so it can cause malavashtamba or vishtamba in the stool. So malavashtamba can cause strain on the heart. Hence, astringent foods are better avoided. Exercise, it can strain the heart. Exposure to sun and heat, it can aggravate the pitta. Anger will aggravate pitta. Anger again is a negative emotion which uh, related to the mind and can disturb the heart. So anger, so patient who or a person who becomes angry will have increased heartbeats. So anger will impact the heart, the functioning of the heart suddenly. So anger or any negative emotion for that matter should be uh, avoided, or try to uh, create an environment around the patient so that those negative emotions do not come out of uh, the patient. Anger or grief, indulging in sex, of course, any physical activity is better avoided by the patients of Hridrog. Yeah, with this, we conclude Rudrog. If there are any queries, you may ask.
I've got a
What
question about the pain.
about?
The heart pain.
Uh-huh.
I take it can be referred to the back as well, not just in the chest. Is that correct?
Yes. Yes.
And so they could feel like contractions.
See, that is a referral pain which comes at the base of the scapula behind.
Yeah.
Okay, because it is a region which is in contact of the heart from behind,
Yeah.
and that pain can refer to the shoulder region, neck region also. Okay, so that is a referred pain because of the nerves which supply these regions is common.
Yeah.
Okay, and any disturbance in the functioning of the heart, physical functioning of the heart. Uh, so when it is pain or the at what is it called? palpitation, that time this referred pain can be seen. So referred pain is quite a typical uh, presentation which the patient can tell you that I have pain behind in the back region also. So that is basically at the tip of the scapula. So heart is here from the front side, back side, tip of the scapula here. The patient will have, and this region also, this region on the left side especially, the patient can complain of pain. That is the referred pain due to pain in the chest.
And
That is
can they
currently
feel
in
like
heart.
contractions coming and going? That pain in the back, at the base of the
In
scapula?
the back, not contractions basically. If it
No,
is
so
contractions, then it
then
can
that
be
could be
related to,
muscular.
that can be muscular one, and that can be related to the gaseous distension in the abdomen.
Right.
Yeah, because gaseous distension in the abdomen, admana, correct?
Right.
So admana will increase, so vata will occupy the space in the
Yes.
abdomen. It will create pressure, upward pressure on the diaphragm, which will stimulate the heart and which can cause pain in the chest region, and that can refer in the back as well. So that time you may feel the contractions.
Thank you very
So
much.
it
That was
can be
extremely
muscular or
helpful.
it can be related to the gases.
Right. Thank you. That was very helpful. Thank you for explaining that.
Okay. Fair?